Good morning. My name is Catherine Workman, and for those of you who don't know, I am an intern with Home of Hope Cancer Wellness Center, and I am a grad student in the master's program for social work with Aurora University. Unfortunately, my time with Home of Hope is coming to an end soon, but I wanted to share that March is Colon Cancer Awareness Month and kind of what that means to me. In 2013, March 18th of 2013, my husband, Jim Gainey, was diagnosed with stage 4 colon cancer. And at the time, it had spread to his liver and his right lung and his lymph nodes. And it came as a complete shock to us. So that really obviously sparked a passion for raising awareness about colon cancer for me and his family and our friends. So I thought it would be relevant, since we're still in March, to share some facts about colon cancer, how it can be prevented, what symptoms are, and I can share a little bit more about our experience in particular as well. So as I stated, March is Colon Cancer Awareness Month, and colorectal cancer is a cancer that is found in either the rectum or the colon. Most of these cancers develop from a polyp, which is an abnormal growth in the colon that can become cancerous if not removed. When colon cancer is detected in early stages through a colonoscopy, it's very treatable. If it's stage 1, sometimes all it requires is removal of the mass in the colon, and colon cancer or colorectal cancer is the third most common cancer and the second leading cause of cancer deaths. So obviously, if it progresses beyond those early stages, it's harder to treat and much more likely to be terminal. The common symptoms of colorectal cancer are changes in bowel habits is probably the most commonly talked about one. There can be constipation or diarrhea. Everybody's different. So if there's a change in your stool for you, then that's something to consider talking to your doctor about. Persistent abdominal discomfort, such as nausea, vomiting, loss of appetite, feeling bloated, things like that. Rectal bleeding is often a common symptom related to colon cancer in certain parts of your colon, and probably the one that most people know about as well. If you see blood in your stool, it is important to contact your doctor after that first event. Unfortunately, colon cancer is becoming much more prevalent in the younger generations, and the diagnoses are sometimes delayed, because if you're reporting that there's blood in your stool and you're 30 years old, they could say there's something like hemorrhoids or issues with your diet. And that's actually exactly what happened with my husband. He had one incident of blood in his stool 6 months before his diagnosis, and they said it was hemorrhoids, even though there was a family history, and that's why I sent him to the doctor in the first place. And so he was not diagnosed for about 6 months, and in that time period, there was a possibility that his cancer could have been caught early and he could still be living today. Weakness or fatigue, that is often related to anemia. When you have bleeding in your colon due to the cancer, you become anemic. You're low on iron, and that is going to cause more weakness and fatigue within your body. For Jim, like I said, he was 31 when he was diagnosed. Our children were 3 years old and 10 months old when he was diagnosed, but for about 3 months leading up to his diagnosis, he was going to bed at like 7 o'clock with our 3-year-old. You know, he could make it up until it was time to put the kids to bed, and then he was going to bed himself. He was always a very high energy person, always on the go, working hard, playing hard. And so this was a complete switch from the lifestyle we had been living, which was typically put the children to bed at 7 o'clock and we would hang out and watch some TV shows, but he couldn't stay awake. So he was putting himself to bed at 7. Unexplained weight loss is another possible symptom with Jim. Jim was 6'2" when he was alive, and he averaged about 210 pounds at a healthy weight with his like tall and broad stature. And about 2 weeks leading up to his diagnosis, he dropped a ton of weight and became very gaunt and very thin, and we had no idea what was causing it. And I want to add in here with Jim, the other thing that he experienced was severe back pain for about 2 to 3 months leading up to his diagnosis. And that was in relation to the mass in his colon, really pressing on the back of his back. And he was told when he went to the doctor about that it was due to a labor intensive job. He was a chief engineer for a hotel company. So he was responsible for repairs and things like that. So he was a very active guy. And so his back pain was just kind of passed off to like, why don't you go see a chiropractor, which he did, and it didn't improve his symptoms. So back pain would be another thing. He also experienced night sweats where he was soaking through our sheets on a nightly basis a couple of weeks before his diagnosis. And that was due to the tumors in his liver causing that reaction, which was confusing. And he would get up and shower in the middle of the night because it was that bad. So those aren't typically declared as symptoms of colorectal cancer. However, everybody's situation is unique. And I think it's important to, when you notice some sort of change from outside your norm with your body, that you advocate for answers from your doctor. And that's what it came down to for us. For Jim, what ultimately led to his diagnosis, even though the doctors were aware of the back pain, aware of the fatigue, aware of the incident of blood in his stool, he ended up at the ER the night before he was finally diagnosed with pain in his abdomen. And he had his appendix out approximately 19 months beforehand. And so he knew that pain was not related to his appendix. And the doctors did not press on his abdomen. They did not order any scans that night. His blood work looked fine. His chest x-ray looked fine. And they told him to go see his general practitioner the next day. And all it took was the general practitioner pushing on his abdomen to feel the mass and order a CT. So my best advice is listen to your body. And when you're noticing changes with any of these things that are either listed on this PowerPoint or that I've mentioned, that it's important to advocate for yourself until your doctor is ordering the proper testing to rule in or out any of these things. Risk factors include being overweight, smoking, excessive alcohol use, not having a physically active lifestyle. They are relating diets high in red meat and consuming too many processed foods such as lunch meats or hot dogs to the rise in incidences of colon cancer. What it came down for us really was family history of polyps or colorectal cancer. Jim does have a family history of colorectal cancer. on his father's side. His grandmother had been diagnosed, but she was probably in her 60s when she was diagnosed. And so nobody expected that a 31-year-old Jim would be diagnosed with colon cancer. We anticipated, based on his dad's proactive approach to colonoscopies, that Jim would go in for his first colonoscopy at age 40. At the time of Jim's diagnosis, the screening age recommended was 50, but it has since been lowered to 45 in the past year. And so we thought waiting until he was 40 was reasonable and a proactive approach. But if you have a family history of people with polyps being removed or diagnoses of colorectal cancer, you are placed at a greater risk, especially if it's like a first degree relative. So if you have a parent or a sibling diagnosed with colon cancer, you should be getting yourself screened 10 years prior to when their diagnosis was. For example, if your dad was diagnosed at 50, you should be going in at 40. With my children, because their dad was diagnosed at 31, I will be taking them in at 20 years old, if not before, given that we know the aggressive nature of Jim's cancer, the mutations that were involved in his cancer, and that it obviously can have an earlier onset than any of us ever would have anticipated. So inherited syndromes such as Lynch syndrome or FAP, which is your body overproduces polyps in your colon, those put you at greater risk for being diagnosed with colon cancer. Race and ethnicity, African Americans and Ashkenazi Jews have higher risks of being diagnosed with colon cancer, as well as if you have a type 2 diabetes diagnosis. The most important thing I can say is knowing your family history can save your life. So if you have high incidences of cancer diagnosis running in your family, there's a possibility that you have Lynch syndrome. Lynch syndrome predisposes you to a number of different types of cancers, potentially, such as colon cancer, endometrial cancers, brain cancer, prostate cancer, pancreatic cancer. So if you are noticing that multiple people in your family have been diagnosed with cancer, it would behoove you to have genetic testing done to see if you have Lynch syndrome or if they have Lynch syndrome. Because once you have that diagnosis, that genetic testing done, that information is powerful. It can literally prevent cancers for your entire life, for your children, because you would be put on a yearly surveillance schedule with your doctor to have regular colonoscopies, have regular scans, have mammograms, those type of things, to catch any type of cancer early. So Jim did not have Lynch. His cancer was had mutations that made it more aggressive. We're thankful he didn't have Lynch, but we know that his colon cancer family history is unfortunately a very powerful factor that that I take very seriously when it comes to our children, and his sisters take very seriously when it comes to their children and themselves, because this has placed all of them at a greater risk. Certain prevention when it comes to colorectal cancer. Regular colorectal cancer screenings are the most powerful tool against preventing this cancer. That means regular colonoscopies. If you're 45 and older, you should be scheduled in that colonoscopy. If you have a family member in close relation to you who's been diagnosed, you should be getting screened. If you have a family, a syndrome such as Lynch in your family, then you should be getting screened. If you have any of the symptoms, as previously mentioned, you should be getting screened and advocating for a colonoscopy. Unfortunately, sometimes insurance can be a hang up, and it's very frustrating. It's something we went through with my sister-in-law when Jim was diagnosed, that she was too young to be getting a colonoscopy, but thankfully her doctor helped advocate on her behalf with the insurance company to provide coverage, given that she was at greater risk with her brother's diagnosis. Maintaining a healthy diet, rich in fruits, vegetables, whole grains, and low in red meats, is also a way to help prevent this. Being physically active, exercising, maintaining a healthy weight also reduces your risk. Alcohol intake of no more than 1 drink a day can help prevent this. Quitting smoking or not smoking at all are also a prevention factor, and increasing vitamin D intake with supplements, especially when we live in a climate like Illinois. We all tend to be a little bit vitamin D deficient, given that we have to experience these long winters. So aside from colonoscopies, there is another colorectal cancer screening that you may have heard of, which is called Cologuard, where you can provide a sample of your stool and they will screen it for any indications of cancerous cells in your stool. That is a obviously less invasive method, but once again, insurance can kind of be tricky given ages and things like that. And honestly, most places recommend a colonoscopy over that, just because if you're having a colonoscopy done and a polyp is found, it can be removed immediately. So sometimes if you are doing the Cologuard method and something comes back on that test, then you may have to still go in for the colonoscopy. So just something to keep in mind. When to see a doctor, the earlier the better. Honestly, early detection can lead to better outcomes, because with colorectal cancer being somewhat silent up until it's progressed, you know, just like with other cancers, mammograms, you know, can be helpful in catching breast cancer early. It's the same thing with colon cancer. Your doctor can determine through testing if you have cancer or some other type of health condition that might require treatment. So if you're concerned about any of those symptoms that you might be experiencing, seeing your doctor, sharing your family history, sharing what your symptoms are, being as explicit as possible will get you to the testing that is required. Anyone, like I said, anyone 45 or older is within that appropriate screening age at average risk. However, like I mentioned, if you're having symptoms or you have a family history, or you might have genetics that are predisposing you, then it is advised that you speak to your doctor about scheduling a colonoscopy. And even children and young adults can develop colon cancer. It does not discriminate based on age. Like I mentioned, my husband was 31 when he was diagnosed at stage 4. However, I know children literally ages 10, 11. I knew an 11-year-old girl who was diagnosed with stage 4 colon cancer that passed away about 2 years ago. I know of a handful of boys right now that are probably in the 12 to 16-year-old age range that are diagnosed with stage 4 and undergoing treatment. And there was recently a girl in Iowa who is, I want to say she's about 15, and she has been diagnosed with stage 4 colon cancer and Lynch syndrome. So it does not matter if you have a colon, you are at risk. There are certain ways to prevent it, but that screening tool is really your best option if you have concerns. And I would say if you're feeling like you're dismissed by a doctor, then you go for a second opinion and you advocate for yourself for the colonoscopy, for the scans, for the testing in order to get the answers so it can be treated. appropriately, because testing scopes are so much easier than undergoing years of chemotherapy if it is caught early. For my husband, he underwent 54 rounds of chemotherapy and some procedures prior to passing away after about, well, it was almost exactly 2 years and 10 months after his diagnosis that he passed away when he was 34. So I would just like to leave it with that family history is so important. Advocating for yourself is so important. And early detection is so important, along with if you are, practicing any of the things on the list that fall under ways to prevent it. If there's, if smoking is a habit of yours, finding a way to quit, using the resources, the Quit Now resources, that type of thing. If your diet is not, as healthy as it could be, maybe low in fiber, low in fruits and vegetables, increasing that intake to help prevent it as well. Getting out and exercising is going to be easier now that the weather is getting nicer. But more than anything, I want to be able to share my family's story, because I don't want other families to have to experience this. And if you have any questions, please contact Home of Hope. We certainly wish that our story, my husband's story, can help prevent others from having to experience this, and hope for better outcomes for people who might see this. So, and the references I've used, if anybody would like to do more research for themselves, Colorectal Cancer Alliance is www.ccalliance.org. So, and the American Cancer Society has information on their website as well regarding prevention, detection, treatment, screening options as well at www.cancer.org. Thank you for watching this.